Well, good afternoon. Is everybody excited to be here? Yeah, we're in person. We're in person. That's good. Yep, he's giving me the high sign. I got to stand back here so they can keep me on film. Wow, it's good to be here. It's good to see everybody, and I'm very excited about the opportunity to be the first guy speaking. So I want to give you something to think about, and I want to. We are all in a group of very unique people. We're all disruptors. How many of you want to have the moniker of being a disruptor? We are disruptors. But guess what? There's other people around us that are doubters and protectors. Does everybody understand what I'm talking about when I say disruptors, doubters, and protectors? Well, we're outnumbered by the protectors by 10 to 1 or 20 to 1 or 30 to 1. And the question on the table, and I was asked, Sean and I had a conversation a couple months ago, and he said, would you come and talk about agencies? I've been running insurance agencies for 5 decades. Bought my first insurance agency in 1973, and I brought a number of them out of the ground from scratch, and at one point at $100 million in commission income I was responsible for. I've also been rendered irrelevant by the stroke of a pen 4 times in my career. So I've seen a lot, done a lot. At the end of the day, what I want to do today is encourage you, because you have an opportunity, but you're going to have to be able to do something that's vitally important. Disruptors, doubters, and protectors. What we need to have here is sustainable disruption. So what in the heck is sustainable disruption? What that means is that whatever we're doing here at Health Rosetta, whatever you're doing at Health Rosetta, whatever we're doing collectively as a group, it needs to be sustainable, which means there has to be a business process. Now, I'm going to lean on agencies today and talk specifically about agencies. If you're running a business that's involved with this at any level, this applies to you, okay? Because we all run businesses at the end of the day. So, what does disruption involve? Well, disruption, right off the bat, involves change. And it also involves chaos. How many of you like chaos? David raised his hand. He is the architect of chaos. Opportunity, education. How many know it involves a little bit of pain? And I'm going to show you some pain in a few minutes about an actual case where pain was pretty significant. It involves leadership. You know, there are a number of people in this room that are phenomenal leaders, and you have to have leadership in order to manage yourself through disruption. And then risk. Because when you're disrupting, you're like the pioneers going over the mountains in the 17th century. The first guy that went over the top of the Rocky Mountains, he was a pioneer, and it was messy. There was lots of things that happened that they didn't count on. So there's risk and there's sacrifice, but there's also reward. So what I've been asked to talk about today is community health-owned health plans. How many know that a community-owned health plan is disruptive by its very nature? You're basically upsetting the apple cart in a community, and some of you in this room have been involved in that, and some of you are going to be involved in it, but Health Rosetta's reason for being is to establish community-owned health plans, which I think is a really cool thing. I've been involved in 1 or more community health plans for the last 4 or 5 years. I have seen them. They take on there's all kinds of hurdles you have to go through to pull it together. But at the end of the day, the community-owned health plan is disruptive by its very nature. So the question is, how are you going to build your agency? And you notice I scratched out the word agency, employee benefits practice, to drive sustainable disruption. How are you going to build your agency to drive sustainable disruption? So when you do a community-owned health plan, the first thing you want to talk about is how solvent are the facilities and providers that we're dealing with, okay? But also, the elephant in the room. What's the elephant in the room in a community-owned health plan? And you look at all the different people that are involved in a community-owned health plan, which includes most of the people in this room. Well, the elephant in the room is real simple. It's money. And why money? Because money is the oil that greases the wheel that makes everything happen. And a lot of us are talking about wonderful, great ideas and lots of creativity, et cetera, et cetera. At the end of the day, how many of you are not running a business? Is this not a business? Absolutely a business. It has to be a business. It has to be a profitable business. And it has to grow. So the question really is going to be, what constitutes sustainable disruption? Well, the first thing it has to do is it has to be scalable. The second thing it has to be profitable. And the third thing, it has to be relevant. So are you scalable, are you profitable, and are you relevant? Now, Brokers in the room, take heart, because you will always be relevant. Sales, Dan Meylan's School of Salesmanship. It's the product, the process, and the politics. The broker's responsibility is the politics. You leave the process and the product to the rest of the professionals in the room that do what they do. David's a master at this, okay? He manages the politics of the group. That's the idea of the broker. One of the challenges, and I'm going to take a good friend of mine who is a local hero inside of Kansas City, Patrick Mahomes, okay? Patrick is the quarterback of his team. But guess what? Without the team functioning as a team, and without coaches, and without players and people and strategy and tactics, he's nothing. And you as a broker without an infrastructure around you will not be sustainable. We're excited in Kansas City because we think Patrick Mahomes is going to live to be the same age as Tom Brady, which means we got another 40 years of Patrick Mahomes. Okay? Not really. But at the end of the day, you see the idea. And it requires an operational infrastructure. It requires talent, resources, and time. And one of the challenges that we have today in our existence for all of us is this question of time. How much time do we have? We have all there is. And every single one of you has exactly the same amount of time. There's no more, there's no less. It's not a question of time, it's a question of how you use it. Okay? But you have to look at this. It's going to require sustainable disruption, operational infrastructure, talent, resources, and time. So let's talk a minute. I'm going to go to for the last 20 years, I've been teaching people how to run businesses. And I'm going to give you the genesis of how a business evolves. So a business starts out as survivors. How many have been in survivor mode in your career? Okay? Survivor moves to significant, or to successful, and then successful goes to significant. And going from survivor to successful is pretty easy. Going from successful to significant is really hard. And I'll show you why. Survivors play defense. We can play defense all day long. Successful plays offense, but significant coaches the team. Which means if you're coaching the team, you're not on the field. You now have people around you that do what you want them to do the way you want them to do it. And they're probably smarter and more talented than you are. Okay? Survivors beg for customers. When you were in survivor mode, what was the first thing you had to have? You had to have a customer. And I'm fond of saying, I've been training brokers for many years. Rookies, the pros, and the superstars. If you're a rookie producer, you're writing insurance on cockroaches. If it walks and talks, it pays a premium, you're figuring out how to put them on the books. When you become a pro, you get to choose your customers. But when you become a significant superstar, you're now having customers come to you. You're creating customers. Okay? So, cash flows. We talked about money. Survivors have marginal cash flows. Successful has adequate cash flows. Significant has excess cash flows. Significant businesses are pumping out money. And the reason that's important is because money greases the wheel for further growth and extension and sustainability. So, let's talk about infrastructure. When you were a survivor, did you have a whole lot of infrastructure around you? Probably not. As you built your company and became successful, you started to develop some infrastructure. But significant businesses have proven reliable infrastructure. One of the things that has to happen with the community-owned health plans is there has to be an infrastructure. That's what Health Rosetta is all about. That's what Sean and David are trying to do. Let's figure out an infrastructure here that we can place. It's hard. It's not an easy project to do. It's going to take time and money and resources and very collaborative people. Okay? So, if we are going to have sustainable disruption, it is going to require significant businesses. I'll say it again. If we're going to have sustainable disruption, we have to get to the place where some of you as brokers and run organizations that are capable of scaling. Okay? So I'm going to talk about Payer Compass because that's what I work for at the moment. Our commitment is to sustainable disruption. All right? We have a repricing technology that's scalable. We are getting ready to sign a contract to reprice claims for one of the largest health systems in America right now. It's not a small contract, okay? But the point is, our technology is absolutely scalable, okay? Reference-based pricing and other alternative health plans, the provider directory and provider transparency, all of these things are on the horizon and here in front of us, and they're going to continue to evolve over the next 3 to 5 years. It can be the wave you can ride, or it can be the wave you drown under. You just got to figure out how to get in front of it and work with it. Because guess what? Every wave is a new wave. And after you figured out how to ride one, then you ride the next one, and the next one, and the next one. Pretty soon you become a pretty decent surfer. But at the end of the day, you got to ride waves to learn. So in our enterprise transparency solution right now, we're doing all kinds of things: advanced EOBs, price transparency, provider price transparency, qualified payment amounts, machine-readable files. How many have spent any time thinking about machine-readable files? You're thinking about it. Let's play a little what if. Let's assume for a minute all providers now actually generate machine-readable files. Well, payer companies have the capacity to aggregate all of that and start to put out real-time information about how pricing is going to look and what an appropriate price is for a particular service. Not necessarily reference-based pricing, but it's an aggregation of data. Payer companies' machines will do that, hands down, all day, every day. So our particular commitment to sustainable disruption is we're scalable, we're profitable, we're relevant. We have talent. And what's been interesting is that we were acquired by private equity 2 years ago, and there's been a consistency of acquiring talent. There's a new young lady here that's part of our team that just arrived not too long ago. I arrived 2 years ago. My chief revenue officer arrived 2 years ago. We've hired a bunch of very, very, very talented people. Do we have it all licked? No, not yet, but we're working on it. And talent will eventually solve the problem. But what does it take? It takes time and resources. If you're going to tackle the problems we have on sustainable disruption, you're not going to snap your fingers and make it happen in 20 minutes. And it's going to be painful. There's going to be problems. There's going to be issues. We're going to have disagreements, etc. We got to keep pushing this thing forward. But there's a business model that has to be sustained. So let's make this about you. Let's make this about you as the benefits agency for just a minute. And by the time I get done here, I'm going to try to leave 5 minutes to allow for some questions and answers, because I'm going to challenge you here. I want to define unsustainable disruption for a minute. I was involved in an environment where we were doing a certain kind of a program, a certain kind of product, and all of a sudden, in a period of 120 days, we went from 10,000 policies to 60,000 policies. How many of you could sustain 600% growth in 120 days and live to tell about it? Ain't happening, right? Well, imminent chaos. Imminent chaos. Now, here's the good news. It came with $6 million worth of revenue. The bad news was it came with unbelievable chaos. And it actually cost us more than $6 million in revenue because of what we lost on the backside. I'll get back to this in a few minutes because there is a solution, but I want you to use this as an example. Okay? In the last 20 years, I've been teaching people how to run business. And there's 9 core competencies. If you're going to run your business and scale it, you have to be good at all 9 of these. And you don't have to be the best, but you as the business owner, the business leader, have to be able to look at these 9 core competencies and say, this is something I'm good at or I'm bad at, and I need to go find help. So in the middle, you have core deliverable. And I'm going to pick on my friend Garrett, Health to Business. The Health to Business guys are about direct contract administration. If you don't know your core deliverable in 5 words or less, then you don't know what it is. If you're a healthcare broker, it's healthcare risk management. That's what you're there to do. You're there to manage healthcare risk. Now, inside of that core deliverable, you have a differentiation, you have a value proposition, you have vendors and suppliers that make that unique. Around the outside, those 8 other core competencies exist in every business. When I first came up with this model, I superimposed it over the top of Chick-fil-A. What does Chick-fil-A make, Tina? Can everybody make a chicken sandwich in here? Yeah? Yep. Can you make $9.2 billion worth of chicken sandwiches? No. It's about the systems, the processes, the planning, the marketing, the leadership, finance, administration, human resource systems, and sales. Okay? All 8 of those have to be done well. On a scale of 1 to 10, if you evaluated their competence in each one of those areas, they got a leader that are 9.5 going to 9.7. Okay? The question on my mind, if you're running your own small business and you got 7 people in your organization, you probably wear all those hats, but nobody's ever showed you. And you wear all 7 of those hats in one sentence. Things get a little chaotic. So, let's talk about one of the pieces of the puzzle that will be absolutely necessary if we're going to have sustainable disruption, and that piece is talent. Okay? Right now, how many know talent's in short supply? I'm going to say something, you write it down. Competence comes at a cost. It'll never cost you more than incompetence. I'm going to say that again. Competence comes at a cost that'll never cost you more than incompetence. So where are we going to go find talent? Well, talent is in the bottom center box. It's called human resources, right? That's where talent originates. But here are all the parts of the business that are affected by that talent search: planning, leadership, administration, systems. All those conversations have to take place, and you have to have a system and a process to manage it. So if you want to get and come talk to me later, we can get into this a little more detail. Zach just showed me the 5-minute number. So let's talk about this. In that 120 days, how did we solve this problem? Well, first of all, it took 2.5 years to unwind this. And the first thing that happened is the company I was involved with went out and hired 2 leaders. And they spent well over $400,000 on their salaries, but they found 2 high-level quality leaders, put them in place, and then they started searching for the infrastructure and building the infrastructure they needed to support that kind of sale. We had to go through 200 people to find 35 over 2.5 years. So that the whole idea is you cannot scale without talent. You're going to need to have talent in order to scale your organization. The other thing we need is metrics. And this is where a lot of brokers don't do a really good job. So I'm going to show you something here. Here's an operational dashboard for a typical agency. And we don't have a lot of time to get into this, but there's 44 groups. We have 5 producers and staff. We have 2,200 plan members. We have $660,000 in revenues. $25 PEPM is the average charge. Agency revenue per employee is $130,000. How many could cite that information on your agency today? Good for you. Excellent. All right? You need to know this, because here's the question. In 10 years from now, I want that agency to have 200 groups, and I'm going to have, in order to have 200 groups and 40,000 lives, I'm going to have 84 employees. And those 84 employees are going to be generating $200,000 of revenue per employee and throwing off $2.5 million in operating profit. That's now a significant business. So here's how I'm going to conclude this. I'm going to challenge you, because this is what Health Rosetta is all about. Sustainable disruption means we got to grow. And we got to grow profitably, and we got to invest in the people around us. So if you had 350 Health Rosetta producers all generating 40,000 members, that's $5.8 billion in commission revenues, and it's 29,000 employees. Now, is that significant? Yes. Does that disrupt? Does that scale the disruption? Is disruption scalable to that level? 14 million people affected by Health Rosetta. We need to scale. But look, if you go back one slide, 10 years, 2022 to 2032. It's not a 1-year deal, not a 2-year deal, not a 3-year deal. It's a 5 to 7 to 10-year deal. Okay? So here's my challenge. Our commitment is cutting-edge technology, leveraging transparency, unparalleled talent, and we're going to partner with the Health Rosetta community, whatever that looks like. And guess what? None of us really know what that looks like, because it's an evolutionary process. The biggest thing we can do here is talk, learn, collaborate, and figure out solutions. So, your challenge: build your employee benefits practice for sustainable, significant disruption over the next 10 years. Thank you very much.
We have time for Q&A, so just one request: speak into the microphone, so I'll bring it around. Raise your hand. Do you have a question?
I kind of went through that in a hurry. Is there any online that...
None yet.
Okay. I should have said something at the beginning if you're going to have a question. But so does anybody have a question?
Just a minute, Carolyn. Right here. You want to take the mic.
Did I see cost of those employees?
No. What you saw was the revenue per employee. So what you want to do, the measure of productivity in agencies, you take the total revenue, divide by the number of employees, right? And what we're trying to do in growing an agency, if I'm the agency principal, I want to see my revenue per employee continue to grow, right? And that's where talent comes into play. I have a client in California. He went from 19 to 21 employees, and his productivity went down because he was overstaffed. We fired 7 people, hired 3 more that were a lot smarter, a lot sharper, and a lot more efficient, and we went back to our profitability. Profitability is not always about money. It's about the quality and the competence of the people that work for you, right? And that's hard. I mean, at the end of today, what are we missing? We're missing talent. Any other questions? Comments? Thoughts? You think I'm crazy?
Advisors don't listen to instructions quite well.
Sorry.
No, you're good.
Is
You're
it
good.
total staff, including like admin people and
Yes,
stuff? Or
it's
just-
everybody.
Okay,
It's
thank
body
you.
count. It's body count. Now, there's a lot more sophisticated way to do this, but for the purpose of the 30-minute presentation, I kind of went high level on you, but there's a lot more to this than we could do. Yes, sir.
Hi. Can you talk a little bit about how you build a community health plan, from soup to nuts?
From soup to nuts? Well, let's put it this way. You got to be patient. You got to be it starts with relationships, and then it starts with trying to figure out what's actually going to stick. That's a loaded question. We could stay here for an hour and a half. I mean, the right person to ask that question to is probably Garrett and the guys who are going to follow me at H2B, because they're probably closer to be in the middle of that. I have worked on one community health plan, took 4 years. Okay, 4 years. There's other people here that have been successful with community health plans. It's a process. It's not an event. It's bringing people into knowledge and understanding of what's possible, and then getting them to buy into it, and then getting to commit to it, and then getting them to own it, and then getting them to deliver it. And that's a process. The program that I worked on with the community health plan in Central Missouri, we started that process, and then what happened? COVID came along. And COVID basically stopped everything dead in its tracks for a year and a half. Because the inertia was there at the beginning to do it, and then all of a sudden you had this outside. When you get rendered irrelevant by the stroke of the pen, it will come out of the left field. One of the things we talk about in planning is contingency planning. What to do when something happens you didn't count on. Because it's going to happen. I was rendered irrelevant by Jimmy Carter in 1983. Anybody remember 18, 20% interest rates? Okay? My customers were going out of business. I wasn't going out of business. My customers were going out of business. All right? Yeah. Any other questions, Zach? Go ahead.
Yeah, you have a lot of experience, obviously, 5 decades. If you could wave your magic wand, how do you align 350 independent brokers, consultants that maybe obviously are all different businesses to create something like this? Because I think you're going in the right direction.
So here's the deal. At the conference we had at UPowered in Phoenix, there was a really interesting question. What is the perfect future? What does the perfect future look like? This is like fighting a battle, okay? We're at war, and what's the single destination that we're trying to get to? What does the Super Bowl look like? What does it look like? If we're all focused on that, we're going to get in each other's way a little bit, but at the end of the day, if we can all focus on something that we can all agree to and move in that direction, it will unite us by moving in that direction. What happened when 9/11 went down? Okay? The entire nation focused on that issue and stayed there for a period of time. And then pretty soon it kind of fell apart. That's what we need to do, is we need to create focus. We need to get energy and inertia. Part of what Health Rosetta is all about is to do this. They're trying to define what the destination is. God bless them. It's a great opportunity. Why am I so passionate about this? I have 7 grandkids. Okay? And this particular issue is not going away. My grandkids are going to pay to watch me die. Your grandkids are going to pay to watch you die. And it's going to be really expensive. Okay? We got to fix that. And that's what the focus should be. Other questions, Zach?
Just time for one last question. We just got a quick one. I think when you measure employees, how do you factor in part-time employees from Corey Koski?
You use that metric. In other words, if you have a part-time employee, you got somebody that's doing 1,000 hours. 2,000-hour employees make a 1 full-time employee. The point is you just use that. You could have 2.5, 2.7 employees, however you wanted to do it. The point is you're building a dashboard to run your business, and that dashboard needs to take into consideration all the variables that are there. You know, in another presentation I'm a pilot, and so I have a Piper Cub, I have a King Air, and I have a 737. If you look at the dashboard in a Piper Cub, it's pretty simple. If you want to fly a 737, you better pay attention to everything that's going on. You're there managing systems. You're not doing any flying at all. Anyway.
Thank you so much, Dan Meylan.
Great.
Give it up.
Thank you very much. It's been a pleasure.